Well, thank you so much. I'm really happy to be here to talk to you all today. So as Joanna mentioned, I'm from MS Canada, which is formerly the MS Society of Canada. I am the Director of Information and Resources, and I've been here for just over 22 years. I've spent most of my career working with MS treatments and specifically access to treatments in Canada as well as internationally. So I was a MSIF panel member for the EML for both the 2019 and the 2023 applications. So what is the World Health Essential Medicines List, or the EML? It was first established in 1977, and at that time there were around 202 medications listed. Now in 2023, there's 502 listed. The EML provides a set of medications that are recognized internationally to help countries treat priority health needs and develop their own EMLs, national EMLs. Medications added to the list must have clear evidence that shows safety and effectiveness, as well as cost effectiveness, because of course, medication can be safe and it can be effective, but if it isn't cost effective, it's likely not going to reach those who need it. The EML has two lists, so the core list and the complementary list. The core list contains medication, the most effective medication options for key health conditions that can be used without additional healthcare resources. The complementary list contains medications that do require additional healthcare resources, such as specialists and diagnostic equipment. So this is where the MS DMTs fall under the complementary list. There's also a model list of essential medicines for children. However, we won't be focusing on that today. And the EML is updated every 2 years. So this EML is very significant because it marks the first ever EML to list DMTs for medications for MS, and this is a significant win for the global MS community. The World Health Organization is focusing on innovative medications that show clear benefit to both individuals and health systems that are also cost effective for low to middle income countries. The EML essentially will guide governments and ministries of health on which medications should be available in all health systems at all times, and also provides the flexibility for countries to make their own choices on what to prioritize to meet their needs. So how do medications become listed? All applications must include evidence of the medications proposed for safety, efficacy, and cost effectiveness, and you will see cost effectiveness throughout this presentation. They must also demonstrate that the medication is essential in meeting a priority health need. All applications undergo a very rigorous review process by the EML expert committee, and they're also posted to the WHO website for open comments from stakeholders. Key components of the application include detailed information related to the public health relevance, as well as detailed information related to the medication or medications in our case. So this would look at the population affected, the outcomes of treatment, as well as the outcomes or impact of no treatment, dosing, administration, indication, any existing clinical guidelines, the benefits and harms of the medication, effectiveness, cost, and availability. So as I mentioned, I was also part of the 2019 application. So unfortunately, this one was not successful. While the expert committee did recognize the public health need for effective and affordable treatments for MS, they provided very valuable feedback, inviting us to submit a revised application that included all potential therapeutic options for MS, both on and off label. And they also suggested that we engage with collaborators. There were several papers published between the decision of the last application and the current application. So how was the 2023 application approached given the feedback we received? MSIF convened Essential Medicines Panel, or short form MEMP, which included 25 members from 19 countries across 6 World Health regions. The membership was varied, including people living with MS, healthcare professionals, policymakers, pharmacists, and methodologists. 48% of the membership was from low and middle income countries, and we also had an observer from the World Health Brain Health Unit. We collaborated with the World Health Collaborating Center, who was also the co-applicant, as well as the Grade Center, McMaster University, which is located here in Canada, who undertook the facilitation and the methodology of the project, as well as the Cochrane MS group, who undertook research and analysis. Other stakeholders who were engaged were included, as I mentioned, the Brain Health Unit from the WHO, as well as the EML Secretariat, and we also liaised with the Medicines Patent Pool. This is a fairly busy slide. However, I wanted to just share it to show you the in-depth process that was taken to arrive at the DMTs that ultimately were submitted to the World Health Organization. And I just wanted to note at the top, I won't go through any of this in great detail. That's a whole other presentation. However, I will point out in this top orange box that there were 2 guideline panels. So the MEMP, or the Essential Medicines Panel, as well as the MSIF off-label treatments panel, and the work, both panels undertook the same work, and then it came together at the end to form the final decisions for the DMTs selected. I will just go back and say that, as you can see, there was all aspects of DMTs were considered and evaluated, from clinical trials to cost, and everything in between, really. Again, this is a busy slide, but I just wanted to point out a few key things. One, under the All DMTs box, you will see that we included both on and off-label treatments. So there were 30 in total that we initially considered. And this is in contrast to our 2019 application, where we included the 15 authorized DMTs only, and looked at rituximab as the one off-label option. And so also here you'll see the two panels work coming together. So the top box under recommendations is the Essential Medicines panel, and then below it the off-label panel, and then below that, which I likely cannot see, is the where we started to form the beginnings of our list. We considered special populations, which would include pediatrics, pregnancy and breastfeeding, and also a square box groupings. So this was similar classes of medications were grouped together, which would allow countries or settings with alternatives for selection of medications. We then came to our short list, and then finally the 3 selected. So rituximab, going back to the square box grouping with ocrelizumab, and then cladribine and glatiramer acetate. We had tremendous support from neurological and MS organizations who endorsed our application, and many of whom also submitted letters of support, which were included in the application. So what does it mean to have MS treatments listed? We know that around 2.8 million people are living with MS globally, and this number is only increasing, yet there is significant inequity to access to DMTs. By listing MS medications on the EML, the World Health Organization has formally acknowledged MS as a global healthcare priority. The EML provides countries with an evidence-based advocacy tool to gain or increase access to MS medications, to improve long-term health outcomes and the quality of life for those affected by MS, which will also have significant cost benefits to both health and social systems. The cost effectiveness of medications is vital to improve or achieve access to medications for governments and ultimately to reach those living with MS. Listing these DMTs on the EML signals to countries that they have been identified by the World Health Organization as not only clinically beneficial, but also cost-effective for health systems. Having the DMTs listed also will initiate and support discussions across multiple stakeholders related to achieving, increasing, and improving market access to DMTs in low to middle resource country settings, and this through a variety of activities from drug price negotiations to potential opportunities for voluntary licensing. So just to put the 3 DMTs into context, rituximab is already available in many low to middle resource countries. It is already also listed on the EML, and there are biosimilar options which help to with the cost effectiveness. Glatiramer acetate also has authorized generic products. However, it's a little bit more limited in its access in some settings. And then cladribine is newer, but there may be opportunities for voluntary licensing. So for other companies to manufacture generic options at a reduced cost. So to summarize, the impact has both indirect and direct effects. It has recognized that MS is a global health concern. It will raise awareness of MS and DMTs. It will support and instigate discussions around availability and affordability related to access schemes, voluntary licensing. It will be used as a tool. It can be used as a tool for advocacy and will shift the discussion from whether MS should be treated to how to improve access. The direct effect will be felt by 137 national EMLs, as well as national and regional guidelines, or influence, I should say. I also want to just take a minute to acknowledge all those who were involved in this really important work. Our chairs, Bassam, Shanti, Deanna, Thomas, and Holger, both of our panels, the MEMP and the MOLT, our research teams, and as a member society, I also want to just thank MSIF, everybody at MSIF, but special thanks to Joanna and Nick, who put up with a lot of me, and also Pierre, who was always a great support.